Hey everyone, this is Hannah with the Rocket Miner giving you today's video update. Today, once again, most of our main news and updates have to do with COVID-19. Unfortunately, the biggest news we got today was that 2 more coronavirus-related deaths were reported in Wyoming. That includes one here in Sweetwater County, and there was one that was a citizen of Fremont County. These 2 deaths bring Wyoming's COVID-19 death total up to 24. So with the death in Sweetwater County, the Sweetwater County District Board of Health reported that the second of the 3 patients who were hospitalized at Memorial Hospital of Sweetwater County has now become the county's second COVID-related death. This patient was a Green River woman who was in her 90s, who was recently identified as a lab-confirmed case of COVID-19. She tested positive on Tuesday, July 7th. They said that initially she was in fair condition and was managing her symptoms and isolating at home, but as her symptoms, which included body aches, fatigue, and a cough, continued to worsen, and her condition deteriorated, and she was admitted into the hospital on Saturday, July 11th. Hospital staff then reported that she died late Wednesday afternoon, July 15th. Local public health officials are reporting that this older woman did suffer from pre-existing health conditions that are known to put patients at high risk of serious illness or medical complications related to the COVID-19 virus. Today, the Wyoming Department of Health also reported that a Fremont County man who was identified as one of Wyoming's laboratory-confirmed cases of COVID-19 has died. This man was also an older man. He also had health conditions that are known to put patients at higher risk. And he had been hospitalized in another state when he died. The press release about the Sweetwater County death noted, in an ongoing analysis of available data by the Centers for Disease Control and Prevention, underlying medical conditions that put individuals at increased risk for severe illness from COVID-19 most often include heart or lung conditions, obesity, diabetes, and immunodeficiencies. So these are some of the health concerns and risks that we hear about when they say that they have health conditions that put them at higher risk. So for the numbers today in Wyoming, we have 1,644 confirmed cases of the virus. This is up 39 since yesterday. We have 382 probable cases, and overall in the state we have 403 active lab-confirmed cases, and that's up by 32 since yesterday. Here in Sweetwater County, we're up to 147 confirmed cases and 11 probable cases total, with 41 currently active cases. Yesterday during Governor Gordon's press conference, he also noted that the dashboard metrics for Wyoming have changed. That's the group of 6 different metrics that they're watching to determine the state of COVID in Wyoming and our response to it. We had the new cases category that changed a little bit ago to concerning, and now the category of new hospitalizations has also been changed to concerning. I would definitely encourage everyone to go watch Governor Gordon's media briefing from yesterday if you haven't. You can find it on our Facebook page or again all the Wyoming PBS pages. It was a really interesting media briefing. I think it was informative, gave a lot of new information and updates on where we're at with COVID, and then also other issues like the recent budget cuts and things that are being discussed a lot right now in Wyoming. I thought it was very interesting though, because Governor Gordon definitely got very passionate about some of the issues that he was talking about, and specifically in kind of some of the attitudes that people have towards COVID-19. He talked about what people say about their rights and the rights that we have as it relates to the rights of people when they talk about whether or not they have a right to not wear a mask, or the rights of businesses to require masks. One thing he said that I liked was he said there is no constitutional right to go infect somebody else. there is no constitutional right that says you can put others in harm's way. And I think that's an important thing to think about relating to the mask issue, is people want to say so much that they have a right to choose whether or not they wear a mask. And I think that's true to an extent, but as he also noted, businesses also have the right to choose whether or not to require masks when you're inside of them. And he just pointed out that when we talk about the rights that we have, those rights include responsibilities, and we don't have the right to harm other people. And if our wearing a mask or not can impact somebody else's health, there is a question there of, do we have the right to put other people at risk through our actions, which I think is an important thing to think about in that discussion. But then one of the things that the governor responded to that I especially wanted to connect with today and give some of my ideas on as well is just this response to the recent COVID-19 related deaths. He noted at that point yesterday was when we just had the first Sweetwater County case confirmed the day before, and so he noted that and then said that he has received some feedback and some emails regarding COVID-19 deaths that he did not appreciate. He said, when somebody sends me a note that says, well, these people are going to die anyway, they're just dying sooner, I'm offended. And again, just encourage you to watch the whole press conference because it was interesting, and just to hear his responses and the things that he got passionate about that largely I agreed with. I know that not everyone will, but I thought he was pretty spot on in a lot of those things. But I wanted to talk about that point as well, and just some of the thoughts that I've been having recently about that, specifically about the responses that we see to these COVID-related deaths. I know in previous videos I've addressed how people sometimes question, is it valid to say that this was caused by COVID? And we've talked about why they are reported as such and why it is valid for it to be connected to COVID. But in that debate as well, there is this attitude, like the governor said, and like I've seen handling our social media for the Rocket Miner, I've seen responses that are along those lines of like, well, yeah, they died, but they were in the at-risk group, they were old, they had health problems anyways, and yeah, it just comes across as that attitude of like, well, they were going to die anyways, so it doesn't really matter. It doesn't really mean anything about COVID or its risks. And I'm with Governor Gordon. I am offended by that, and I get upset when I see comments like that. We also had a comment on our Facebook post about the first Sweetwater County death, and I honestly got really upset when I saw the comment and I deleted it. But we had a person comment and say, well, I wonder how true this is, or if this is just blue propaganda. It was something along those lines. And I discussed with my editor and some other staff people of if we could delete that comment, because I try not to delete people's stuff on our posts. I think that people have the right to freedom of speech. I think that social media, shouldn't be restricted. It's a part of that freedom of speech debate. So I try for the most part to let things go and let people say whatever they feel like saying, but there are times like that where I feel like it just crosses a line, and that we don't need to allow comments like that on our page, because our line of thinking and reasoning was, what if the family sees that, or one of his friends, and this person is literally calling into question whether or not this death actually happened, or if it's propaganda, and these people are grieving and hurting. We don't want them to have to deal with comments like that. So I've been trying to think about this and the response people have, and again, I think that freedom of speech is important. I try to allow most of the comments on our social media, even when I don't agree with them at all. But I do want to just try to encourage people to be sensitive and to think about what you're saying before you say it. I know social media has this element to it where we're all hiding behind our screens and we can't see the human being on the other side. So we say things that we wouldn't necessarily say to a person's face. And that's easy to do. That's easy for all of us to do on issues that we feel strongly about, especially. But I think it's really important, especially with issues like this, to really think about the effect that your words could have. And I think when it comes to responding to these COVID-19 deaths, we need to be sensitive and compassionate and to think about what people are going through. And I think that comments like that are pretty off base. Even the comments that say, well, these people had health problems, they would have died anyways. Yes, they had health problems, but as I just read from the CDC statement, most of these health problems are things like obesity or diabetes or just immunodeficiencies, which some people are just immunodeficient because of different health concerns that they're going through. And so it's not true to say, well, these people would have died anyways. I feel like in most of these cases, these people were not actively dying. And had they not gotten COVID, they would have continued to live for who knows how many years. So I don't think it's true to say, well, they're dying anyway, so it doesn't really count. But even if you're arguing that, be careful about how you say it, because when you say they would have died anyways, it doesn't matter, what comes across is that their lives don't matter. And these are real people with families and loved ones who are going through such a traumatic and emotional time. Most of these people are dying alone because they have to be quarantined because of the concerns with the virus. So not only are we losing people and they're losing their lives and their families are losing them, but most of the time it is in these really traumatic and difficult and hard circumstances where they can't even be surrounded by their family and loved ones. So just try to keep in mind what people are going through and that people are hurting and that these deaths are tragedies every time. Every loss of life is a tragedy. And just think through that and try to find ways to be sensitive and compassionate and to offer support and love before you start arguing about statistics. And then also just regarding our actions and the steps that we can take and the things that we can do. I think that things like wearing a mask are not that big of a thing to be asked of us. It's really pretty simple. And the fact is that a really simple action for us to take that doesn't inconvenience us that much could actually be a matter of life and death for somebody else. And it's also not as simple as saying, well, if you're scared, just stay home. Lots of people who are more at risk for the virus don't have that option. You don't know. All of our lives are very complicated, and we don't know what people are going through. And you can't simplify it or make blanket statements like that. And we are at this place where things are more open. We're trying to go about our normal lives, more or less. But this virus is still out there. It's still a threat, and that threat keeps getting worse. So we need to take the steps we can to help each other with that. And if that means wearing a mask when you go into Walmart or Smith's, as we've seen is going to be required now, it's not that hard to do, but it can make a big difference. I do believe that there is research and evidence to show that it can make a difference, and it could actually help save people's lives. And if that research is wrong, what's the worst thing that happened? Was that you wore a mask for a while. Like, it's not that hard. Dr. Harris in the press conference yesterday said something that I think was a really good point. She said, "I know every single one of us hoped a few months ago that we were facing a short-term situation. Unfortunately, COVID-19 remains a serious threat and is simply not yet done with us. The good news is, though, that we all have the power through taking simple actions to change the course of this outbreak for Wyoming." I think that's important to keep in mind as we see the cases continue to be a concern, as we continue to see more deaths from it. It's important to think about how we respond, how we would feel if it was our family member, and what steps we can take that are really pretty simple and pretty easy to do that could make such a huge difference for so many people. So I just want to encourage everyone with that today. Thank you for listening. Thank you for checking in with us. We'll keep giving you more news and updates. Have a good night.